Social Security, the federal government's single largest program. In 2014, spending for Social Security benefits totaled $840 billion, almost an entire quarter of federal spending. Not surprising, then, that reforming the Social Security system has been a topic of debate amongst Democrats and Republicans for decades. Yet the end result always seems to be the same. You kick that foul can down the road. But what if we can't kick it far enough? Or what if we have simply run out of road and the next kick launches this can right into oblivion, along with your money? Our guest is an assistant professor at Dartmouth College who co-authored a study that found the forecasts used by the Social Security Administration are biased and could be off by billions of dollars. Dr. Samir Soneji joins us on the hard line. Dr. Samir, thank you so much for being here.
Pleased to be here.
When I saw this, and the first words I saw out of this were dramatically overstated. In the first line of this study, this is what caught my attention right away. How could they have gotten things so wrong, and what kind of numbers are they using here?
You know, we wondered the same thing. We conducted the first evaluation of Social Security forecasts, and what we found is that Social Security forecasts were approximately unbiased until about 2000. Sometimes they were a little too high and sometimes a little too low. And then since 2000, Social Security forecasts have become increasingly biased and increasingly overconfident, leading members of Congress, the public, including your listeners, to believe that the Social Security trust funds are more financially healthy than they turned out to be.
Then let me start right there at the word biased. Biased by whom and who's actually, it seems as if someone then is changing these studies to fit a certain agenda, maybe.
Well, we don't, we looked for influence, and what we found is that there's a lot of subtle, small decisions that go into producing this forecast of, say, for example, how long we're going to live, and ultimately how much Social Security will cost. And all of these little decisions introduce the possibility for very subtle amounts of bias. They compound. It's this constellation of factors. So what we've proposed is a solution by which a lot of these decisions are automated as best as possible to help remove the bias in the Social Security forecasts going forward.
So let me get to 2000 then. What was the trigger, in your opinion, at least according to your research that you saw, that started everything in the year 2000? Why then?
Right. It's not a coincidence that things started, the ship started steering to the right more and more in 2000. I think it was a constellation of factors. First, Social Security became increasingly politicized. What we think had happened is that this politicalization put increased pressure on the actuaries at Social Security, and these are the professional actuaries who forecast solvency. What happened with this increasing pressure, we think, is the actuaries became increasingly insular. They hunkered down, and they avoided the advice of experts outside of Social Security and tried to produce more consistent results. At the same time, the health changed of the population. We started living longer, and we started living longer faster since 2000.
Which it seems may not have been taken into account.
Right, and it's been increasingly not taken into account since 2000.
If I look at this correctly, what I'm seeing here that you found is the Social Security Administration, they have the data, but they don't share it with everybody. There seems to be a secretive nature here, and that seems to be one of the biggest issues.
That was an especially important concern of ours. Many parts of the Social Security forecasting process are indeed shared. There are several important parts, however, that aren't shared or can't be shared because they're subjective, and so they require a lot of decisions that could be automated. What we're arguing, and really in the spirit of President Obama's executive order on openness and fairness, is that the data produced by the government be accessible, discoverable, and usable by the public. There are many academics, there are many interested in public parties that could provide advice, moreover free advice, to the Social Security on how to improve their methods going forward.
I have about 45 seconds left here, so now here comes the $64 trillion question maybe. According to your study, when do you think Social Security will become insolvent?
Sooner than officially projected. All of the biases lead members of Congress and the public to believe that the trust funds are healthier than they actually are, and turned out to be the case. So we might be talking in the order of months or years earlier when insolvency is likely to occur. The most important point is that the Social Security Administration provides the opportunity for members of Congress to consider proposals. And what we're arguing, proposals for reform, and what we're arguing is that these proposals ought to be based on a fair and accurate way of producing forecasts. And that way, the most economically feasible and least politically challenging solutions can go forward.
I would urge everybody to get a hold of this study and read it because it's frightening, but it's a good fright. It's what we need right now to maybe knock us into some common sense. It is basically called an uncertain forecast for Social Security, and this is exactly what it is. Doctor, thank you so much for taking the time to join us. I'll look forward to speaking again.
You're welcome.
All right, take care. Stay with us because the fastest 60 minutes of news, The Hard Line, continues.